Good afternoon. I'm Felicia Foy, Senior Director of Health Equity and Community Impact with the American Diabetes Association. Today, I have a really special guest to share with us about why partnering with the ADA was important, but more importantly, why the type of initiative through the Adult Project Power was important. So, if you will, please, sir, introduce yourself and let us know what organization that you're with.
Okay, great. Excuse me, great. Thank you for having me, Felicia. My name is Maurice Mason, and I have a BS in Health Informatics. Um, I am the Health Initiatives Committee Chairman for Omega Psi Phi Fraternity, and we've partnered with the ADA, I think, for three different initiatives regarding Project Power, an amazing program, Project Power, that we've tracked and seen the benefit that it has for our community. So that's pretty much my background and my engagement with Project Power and the American Diabetes Association.
So thank you. So yes, and welcome. So excited to have you so that you can share more and perhaps maybe through this conversation, other organizations will see the benefits of being a partner with ADA, especially through this collaborative effort. So Adult Project Power, I know that you participated in three of the cohorts with this program.
Correct.
Tell me, why did you see or felt as though it was important enough to join us in this effort?
Yeah, well, I think being a data analyst and I've worked on several community health needs assessments, and the data reveal the disparities, right,
Mhm.
um, in our communities. Therefore, when I initially spoke with you about Project Power and working with the American Diabetes Association and partnering with you, um, I wanted to be involved to the point where we could actually bring awareness and take action on health equity. Because my understanding from being in the health space is that as advanced as our healthcare system is in the United States, right,
Mhm.
it's still very fragmented. And these disparities in healthcare often prevent or limit people from receiving or even seeking healthcare services, right?
Right.
So as a result, health equity creates an even playing field in my mind, without regard to race, gender, socioeconomic status. It creates an even playing field, and I believe those disparities are preventable.
Right.
And Project Power really encompasses and encapsulates, all the tools and resources to help prevent these disparities.
Yeah, and absolutely, as you mentioned, health equity does not discriminate. You know, so we have an opportunity to change trajectories around healthcare if more organizations participate in initiatives like this. So let's talk a little bit about your organization or your fraternity that decided this is something that we need to get behind and participate in. What benefits have you seen from either yourself or your members from participating in Adult Project Power program?
Right. Well, I've seen a lot of benefits, right? My main thing, it's my belief that awareness and education saves lives, right?
Hmm.
And through working with Project Power, as I stated earlier, I believe, these disparities are preventable, right?
Hmm.
So as a result of partnering with the ADA and Project Power and other healthcare providers, and also working on a grassroots level with community advocates, for example, South Candler neighborhood advocates for health and wellness,
Hmm.
DeKalb Public Health. We've really created a coalition. And my goal as a health committee chair is coalition building, which I feel, Felicia, you've been great in help being in this partnership as far as coalition building, right? Which is not short term, but long term.
Right.
Right. And, we've, I've worked with you as volunteers on a Kroger initiative. We have an annual men's health fair where um, the ADA has been present. You attended our last health fair in June. We track that data across racial groups, age groups, because our goal is to see that there's an impact, not just to have an
Right.
event, but to see patient outcomes and an improvement and patient outcomes.
Yeah. So I like that. And one of our goals, Maurice, is always to look for how do we sustain these initiatives? How do we
Right.
sustain? And it's not just a one-time hit. So that's really important when we talk about impact, because when you have the data that can show the impact, okay, this is something we can support, but also how do we keep it moving forward? How do we keep changing modifying lifestyles or changing the behaviors around health? And two things you said that was key was awareness and education. And if you're not aware, that is when it's an opportunity time to really start sharing that education. So we really appreciate your support. Now, again, what individual benefits did some of your members share that they saw after participating with Project Power?
Right. Some individual benefits that I've received in conversations and in plenary sessions and different meetings is we've seen community members and brothers, members of my organization who were in Project Power, which is guided by a healthcare provider coach, right? And one thing that I found that was key was the support system that you get from the discussions weekly, right? And there's so many different shared experiences on those discussion boards that you can incorporate into your own lifestyle. But I had one of my fraternity brothers who lost over 30 pounds. And so you're right. And so as A1C levels go down, right? He shared this where he brought his family into it. So I've had members bring their spouses into it and extended it to other family members and churches and other organizations. Like I said, South Canada Neighborhood Associates, right? They're actually the boots on the ground that are actually engaging communities and talking to people when we don't have the opportunity to be as engaged in communities by having face-to-face with them or organizing events and focus groups and things like that. They're actually interacting as neighborhood advocates in these communities. And to build a coalition with them not only gives us data, but it also gives us inroads into these communities to spread the good word of Project Power. Yeah.
Absolutely. And when you can see an individual life change to that magnitude, you know that the program is worth it and it's beneficial. And a lot of times when we're talking about awareness, and especially when it comes to diabetes, it's modifying its lifestyle change. It is not always easy, but to have that individual coach that can somewhat be, I tell people, it's the person who will keep you accountable, help you to be accountable,
Correct.
and sort of walk with you and journey along with you while you're in the process. So that's kudos to him and kudos to all the members who saw this benefit. And I love the part about bringing together and really building a coalition, but building it from the community standpoint. Having those people on the ground that you talked about. So one of the things we talked about earlier, real quick, was sustainability. And I do believe that one of the ways is when you get communities involved, you get families involved, that is one of the steps in the direction of sustaining this program. And I know before we close out, I know that this has been like your third time participating with us, but we want to continue this collaboration. And this is made possible. This collaboration was made possible by Bank of America and our partnership with them. The ADA, American Diabetes Association, and Bank of America have a partnership where we want to really break those barriers that kind of really gives into health equity, which really promotes or broad health equity. We're trying to break down those barriers, remove some of those barriers. We already know there's so many social determinants of health issues that happen that sometimes prevent us from finding that way to be healthy.
Correct.
I want to ask you, how do you see our partnership going in the future? How do we help others become part of this, especially with the organizations that you're working with?
Right. So one key is that I've been working on, Felicia, is our Pan-Hellenic Council, right? Embrace other members of the Pan-Hellenic Council, meaning other fraternities and sororities, to help engage Project Power, look at social determinants, right? One tool that we use is, of course, your Bill of Rights, right? your health equity bill of rights.
Mhm.
And dealing with education and job opportunities and insulin, access to insulin, food deserts, right? Access to
Mhm.
nutritious foods and things like that. Housing and transportation, education. So all these social determinants through collaborations with other organizations like the Cal Public Health and South Candler and the Panhellenic Council will help be able to sustain these initiatives in my and also using our social media platforms, right? We use
Exactly.
Instagram, we use Facebook, right? So we can constantly
Mhm. Mhm.
engage communities using those platforms as well as our website. We're in the process of updating our website where it's more interactive, where it's not just a website where you can view photos and acknowledging birthdays and events, but also interactive where we can collect data and share data. The term we use is interoperability, which means that not only do you want to capture data, but it has to be useful data that you can share. So,
Absolutely.
mhm.
And we know that numbers don't typically tell us anything that's wrong.
Correct.
Data speaks for itself, right?
Data speaks for
Well,
itself.
yeah, well, Maurice, it's certainly been a pleasure just to learn more how this program has impacted not just your life, but those whom you've shared this information with, and especially your organization, your fraternity, Omega Psi Phi. And
Correct.
going forward, our organization, we're very much looking to expand these opportunities. Um, and we also, ask that you share this information with other organizations so that they too can really receive the benefits of what this program has to offer. Again, this program is available and was really in collaboration with Bank of America. Bank of America is our partner with this initiative, and we're just so excited that they understand the importance of why education and awareness around health, nutrition, and health equity is critically important. And with people like you who continue to amplify the messaging around that, I know that we can help so many more people. And I thank you for having this conversation with me today. And I look forward to more opportunities of collaborating with you and your organization.
Well, thank you so much for having me on behalf of Omega Psi Phi Fraternity. And it's great working with you once again. Project Power is an amazing program. I was in Group One. I participated in it, and I didn't share my story. I actually benefited from it in the sense that I lost about 15 pounds, and
Awesome.
I am still on engaged because it's not just a 12-week program. It lasts for a year. So I'm still engaged. And as new people come on into the program, it's interesting to see their stories and share their stories. So great program. Uh, Great program. Kudos to you and your team and what you do.
Thank you so much. I hope you have a great day. We'll talk soon.
Thank you. Bye bye.
Bye bye.